is recognized.
Number one, I just want to welcome you both and congratulate you both, quite frankly, and appreciate very much. I'm sure this would have been a little bit differently if Dr. Burgess had been allowed to write it completely by himself. And
the first 62 pages.
yeah, well, that's pretty good, actually. And but this is something we all talk about, but we need a lot more of around here, which is genuine bipartisanship, genuine effort to reach a deal, genuine concessions at each side. And I'm proud of our speaker. I'm proud of our minority leader. I appreciate the work you've done on your committee to arrive at a policy agreement. And I know that was a lot of hard work. And then the pay-fors, I think, are good pay-fors. I mean, I know they're difficult for some people to vote for, but I'm very pleased with what you came up with. Like a good little Republican, I would have liked to do more, but I think you did an awful lot. And more importantly, you did it together. And you did it in a way where we'll see if the Senate is smart enough to follow the good lead that you both and your committee have laid out there. I think they're going to get a little pressure, hopefully, to do that. And so, again, I think this is a very hopeful sign. And for me, maybe the best thing that's happened around here since the Omnibus, which I also consider a good piece of legislation, given the fact we live in divided government. It was a compromise situation. So anytime I've seen what I think is a reasonable deal around here, I'm always happy to support it. I think this is a very reasonable deal. So just thank you for your good work on behalf of the American people. And thank you, too, because I know there was a considerable struggle about this. Obviously, the main focus of this is provider costs, but including the community health care centers, I thought was a really, really very good move, and certainly helpful in my district, and I think more importantly helpful to just millions of Americans that use those facilities and need them. So, again, thank you very much. Well done.